want to talk about filler today. I have in one hand Restylane Lift, and in this hand the new Restylane Contour. And they're both hyaluronic acid fillers, but you could see they kind of behave differently. And I'm going to show you in a minute injecting them and how this kind of translates. You can see this is a softer sort of stretchy gel, and it's this new Restylane Contour gel. This is Restylane Lift, which is a little bit more firm. And when you are playing with it like this, you could feel that it holds its structure a little bit better than this one, which kind of is more gooey and will move with the patient's face that you're injecting it in, and that has a lot of implications. So it's a useful demonstration. So here we are with Jody, and she's getting some filler in her face today. So usually when I do filler, here, put your head so it's not bobbling. So when I do filler consultations, you know, the most important thing is to figure out what a patient wants with their face, not necessarily what I want. So what's bothering you? What do you want to achieve?
I would like to look younger, and I've noticed that my face is falling a little bit, and I'd like to counteract that.
Okay. So when I approach a face for revolumization, like the facial aging process has a couple of components. One of them is position of tissue. So as you get older, the tissues actually start to sag and you start seeing the excess down here. Jody doesn't have that too badly. Like even if we did a facelift on her, there's really not a whole lot of sag down here. She might have the beginning of jowls here that she's noticing as a falling of the face, but it's not bad. So that's position of tissues, and typically with that, you really need to put the tissues back where they're supposed to be in the form of facelift. A second component is the quality of your skin, the tone, texture, pigmentation, fine lines and wrinkles, pore size, and to that end you need to be thinking about the skincare that you're using and maybe some laser treatments and chemical peels to get your skin looking as young as it should. But the third component, which we're going to address today, is the volume component. And what happens as you get older is that the position of the fat pockets that are in your face will start to descend, and that's a positional thing that could be changed with surgery, but the fat also starts to atrophy in your face. So replacing that volume can really restore a youthful balance to your face. Jody doesn't have a huge amount of volume loss either in the face, but a little bit out here. And when we put volume, not only will it restore the volume that's lost, but it'll also give a little bit of lift. So you'll see some positional changes that happen when you put the filler. So when I think of revolumizing a face, I think of building a house. When you build a house, you have to form the scaffolding and make the structure of the house. And that's where I start with something like Restylane Lift. This is actually my go-to filler for restoring structural support. So what I'm going to want to do is put some structure back into the cheek. And the beautiful normal of cheek volume would be to have more volume out sort of laterally, so that when you look at her face, it's going to angle in this way. What we don't want is a squared off face. So I'm kind of not someone who does a lot of injection into the pre-jowl. I'll do a little bit, but what I really want is to give the effect of angling the face. So if I give a little bit of volume out to the lateral cheek and then kind of come in after that and feather in some lighter filler, we're going to get a rounded curve to the cheek that restores youth. If she had hollow under her eyes, we could restore that, and then that will give a little lift to the little bit of jowling she has, and then I'll come back and fill in the nasolabial folds. I'm not going to do anything to her jawline because it's fine. Some people need that. There's definitely a whole practice of recontouring of the jaw, and you could really change the whole feeling that you have for the angular jawline, the demarcation between the chin and the neck, and those things, but we're not going to do that today. It's not necessary. So I'm going to start with Restylane Lift, which I showed you is a much more firm filler. I like to think of it's almost like the consistency of a rubber ball, and when I was doing between my fingers you could see that it's firm. And I'll put that in as the scaffolding and start to build up the lateral cheek with it. So I want to make sure that the skin's nice and clean. We cleaned off Jody's skin before we're going to start any of this. And I'm just going to lift the cheek where I want it to be and just inject. I start with just real depot injections that almost, I think of them as kind of a peg that I'm hanging my coat on. And I'll let it sit up here. And you can see that even if you're looking down here, the part of her jowl won't drop down because we've gotten the cheek elevated a little bit. Yeah, I can see a correction here, and you're starting to see that I'm creating more of a high cheekbone. I'm going to come out lateral to give it a little bit of drama, and this really sort of depends on how somebody feels about it. I know Jody likes to have a little bit of drama in the cheekbone, so I put a little bit more lateral. If somebody wants to have less of that, I'd march it in a little bit more. But I've used about half a syringe, and you can see that we're starting to see an angular look here. You know, you could take somebody who has a little more volume in their face, and actually by adding volume could make their face look thinner. And that's by balancing sort of the way that you're injecting it and where you're putting it and the angles that you're creating and the shadows. So I'm sort of creating a shadow out here. Gives me an easier correction. See that? Look, it's nice and flattened. So that's what I'm going to talk about. So right now what we've achieved is that she has some volume and some rounding of the cheek that's making her look like she has a higher cheekbone, but now we've created a look of it being a little bit flattened here. So I'm going to use, I was talking about the reference to building a house. So we've made the scaffolding here, which is kind of lifting up on the jowl area. Now I'm going to take what I like to think of as sort of my drywall and get in there and really mold in and round out the cheek in the front. And for that, I'm going to use this new Restylane filler called Contour. And that is a little bit more pliable. And I could use it a little bit closer up on in the dermis here to round it out, and it's going to move with her a little bit better. This filler has been around in Europe for several years, and it's just launched onto the American market. And I'm using a needle to inject this. If I were going into the tear trough, which is this area under here, I would be using a cannula for it, but because I'm not there, it's not really necessary. Jody doesn't have deep tear troughs, so we don't have to fix that. And I'm going to keep going into the nasolabial fold so we get a complete correction of the nasolabial fold. I filled a little bit in the deep layer with some lift, so that that's good. You have to be really careful injecting into this area because you can embolize the vessel there and get some skin necrosis, so you don't want to inject fast there, but it really is imperative to inject in that area, otherwise it looks like you haven't corrected the fold well. That looks nice. I'm going to inject a little bit around the this is what becomes a marionette line. Jody doesn't have bad creases or marionette lines, but she's a little bit of an indentation. Some people it indents all the way down there and you get that puppet looking line. Jody doesn't have that, but she has just a little indent there, and if I inject into around the lip, I could get the lateral lip to turn up a little bit. You could see it fill in so that she doesn't have a line forming. This will be some prevention as well as fixing. But you could see now that that side of her lip turns up and that side of her lip is turning down. So can you get that? You see it? So this is going up, that's going down. We'll get it to turn up in a minute. Put a little bit more. Usually I do sort of like a, K shaped. The more I put in, the more I get it to turn up. So we give that sort of perpetual smile. I'm going to use the rest of this for this little indented part here so it's not quite so harsh. So the indications for this filler is for the mid-face and cheek. And that's what we're using it for here. There. That's one side done. So I'm just doing the other side to balance the first side. So I'm using the lift here to build the scaffolding. And that's going to be the beginning, like the foundation essentially of what I'm going to use the rest of the filler to fill in. So I'm just filling in the front, just rounding out what we call the OG curve of the cheek. So you want it to be rounded out in front, not only laterally, but anteriorly as well. And then the tricky thing is getting the balance and symmetry. I'm going to come up and just underneath the skin here. And fill in the nasolabial fold the best I can. So now I'm using a Restylane Define for the chin. And what I want to do is inject into the area in front of the jowl so that the effect of it is to even out so that you don't see it down, then up, then down. I want it just to go straight across. So I started building it up here in front. And now what I see is that just underneath here, I need to get some volume. Sorry. So I'm going to come up from below and just fill it in so that that whole pre-jowl sulcus, this area here under the chin, becomes one straight shot across. So it really takes away the appearance of the jowl. So you see now it goes straight here, whereas on this side it kind of goes up a little bit, and this is heading straight. You have to think of this as a three-dimensional structure. You can't really depot that. You've got to build it up little by little until it's right. Okay, now turn back. Yeah, that's nice. It gives some sharpness to your... Look at that. So now it's straight across here. Mold it in a little bit. Okay, let me see. Wow, that's really nice. Can you see that? Look at it's straight across here, but up here.
Botox is a neuromodulator, which means it relaxes wrinkles. We use it in the forehead and around the eyes, which will prevent wrinkling in these areas and keep your upper face young. Filler, on the other hand, is used to put volume back in the face and sometimes fill wrinkles from below. Examples of this filler are Juvederm, Restylane, and Versa. And these things can be used in different ways depending on what your needs are as an individual.